Disclaimer. This program is intended for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The following program is intended for mature audience only.
Hi, I'm Dr. Kathy Swain Jones.
Hi, I'm Dr. Denise Joseph Zollicoffer.
Hi, and I'm Sonia Williams Finney.
And this is
Menopause Diaries, real talk, real stories.
Hello, and welcome to another episode of Menopause Diaries, Real Talk, Real Stories. This is where we get down and get dirty and we talk about menopause and really dive into the symptoms and hopefully get to some treatment and really help people to understand that, this is an interesting stage in our lives and we want to make it the best stage ever. So today we have with us a very lovely woman who has been brave enough to want to share her story with you. And I hope that it will be educational, uplifting, and that you'll feel like you're not alone as we go through this menopause journey. So I would like to introduce to you Bobby Gayle. She is from Florida. Welcome, Bobby.
Hi.
Bobby, I'm so glad that you have decided to join us and that you're willing to share your story with us. So without further ado, why don't you tell us a little bit about your menopause journey?
Well, for me, about 7 years ago, my doctor suggests that I have a hysterectomy due to irregular periods. He did say that I should have a partial hysterectomy because my ovaries was good. If he take out everything, then that will throw me into full-blown menopause.
Mm-hmm.
So as the years go by, I notice different symptoms, not knowing that, maybe it's symptoms of perimenopause. I kind of swept it under the rug for a couple of years. And then I just noticed that, I'm sweating a little too much, or, I'm tired, or my feet is burning. And I went to the doctor and she said, maybe, because I do see a man and a woman at the office. So she said, well, maybe, you in perimenopause, but I guarantee you're not in full blown menopause.
Mm-hmm.
So I get the night sweat. So I get the burning feet. And then as the days and the months and the years go by, I notice different changes in my everyday living. Like my fuse is a little short. I don't know if I'm getting a little older. My patience is getting a little short, but
Mm-hmm.
I think, that's one of them. When I first got my hysterectomy, I had tender shocking pains in the breast. I think that lasts for about 2 years, but now all of that went away. My second sign was my feet. The bottom of my feet was very hot. So if I'm at work or I'm somewhere out, I have to take my shoes off because my feet is literally hot. Just my feet.
And so it didn't move upward, it just stayed in your feet.
Just my feet. And
What age were you? What age were you when you had your hysterectomy?
I was in my early 40s. I probably was 41, 42, around
And
that
how old are
age.
you now?
I am 51.
Okay.
Mm-hmm.
Go ahead. You know what? Go ahead, Bobby. Go ahead.
So after the sweating of the feet, then I get hot flashes. Not severe, but at night I'm waking up like, oh my God, it's hot in here. I never turn off my air condition ever. Summertime, wintertime, never turn off my AC. But at night, I get a little hot, like someone turned the heater on. I'll have to literally get up and cool off for a little bit with the fan. Then after that, about 15, 20 minutes later, it goes away.
Mm-hmm.
But I did notice that if I move suddenly, if I'm cooking and I'm like, oh my God, I forgot the pot was on the stove, and I jump up, I'm going in full blown sweat.
Mm-hmm.
So I don't know if that sudden move triggers it faster. But the night sweats is definitely one of them.
Do you notice any certain foods you eat? Does that trigger it? If you're eating spicy foods or drinking hot tea or coffee, do you notice that at all?
No, no, I don't
And
think the
and
food.
over the years, really, it's just sort of been the hot flashes that have been the most. Have they gotten any better, or are they getting worse, or it's been just kind of
It's about the
progressively?
same.
Wow.
It's about the
Okay.
same, but I notice every now and then I have joint pains.
Yeah.
Now, again, it could be because I'm overweight. This morning I woke up, my right hip is hurting. Like, wait a minute, did I sleep bad or I need a new mattress or I'm just overweight?
Came
Sure.
from halfway across the world too. Maybe the
But
airplane ride might have done that a little
but
bit.
I've been back for a couple of weeks. Well,
Okay. Okay.
So just for the
so
listeners, Bobby was traveling to Japan, and we're all very jealous.
Yes, yes. But Bobby, as all of us, as our hormones begin to decline, because hormones are responsible for some of that lubrication that's in our joints.
mhm,
And as our hormones begin to decline, you and it may have been again because of the traveling, because that's quite a plane ride, that you might have a little inflammation or irritation in your joints. But that is becoming more of a common sign of menopause, is the joint
mhm,
pain, the stiffness,
mhm.
Absolutely. Yeah.
creaking
Oh, the
around.
stiffness is on
Yeah.
100.
Yeah. Yeah. I
Oh,
do. Yeah.
it's literally like someone hit me with a bat
Yeah. Yeah. I
on my
can
right
totally
hip.
relate to that. Yeah.
And you know what? I'm over here and I'm nodding, and I'm sure some of our listeners, they're nodding also, like, oh my God, I'm going through that, because that hip
Hmm.
pain, I totally can relate to that.
The hip pain,
It's
that's
real.
all I did was get out the bed this morning and walk. And I'm
Hmm.
like, no, why my hip is hurting?
Are
Yeah.
you
I go
having
in the hip.
Right in the
are
hip. Yep.
are you
Yep.
taking in omega-3?
No.
Because one of the things that we want to think about is that like your hot flashes and all of that is probably menopause, even though the test didn't pick it up. And for a lot of ladies just like you, they'll go in when you get your blood drawn, it's only telling what your blood is doing that day. It's not
Right.
it. And so you may go in and they say, well, that's probably menopause, and that's why they say probably perimenopause, because you're not
Hmm.
registering in that range. But let's just say
Right.
you are. One of the things, so let's just isolate just your joints. What could I do just for my joints? And there's a couple of things. One is to get on some omega-3.
Hmm.
Omega-3 is a anti-inflammatory fatty acid, and you know how they even come. It's almost like you can just take that oil and just rub it on, but you
Hmm.
take the
Yeah,
capsules. You take some omega-3. You want to take some vitamin D, because another thing that
I
happens
do.
when you very good. And are you
Hmm.
taking any calcium with that?
No.
Okay. And so how much vitamin D do you do? Like 2,000?
2,000
Okay.
units.
Okay. So you got your omega-3, your vitamin D, and another one possibly could be some vitamin E. Now, the reason why
Hmm.
I say vitamin E, because vitamin E is also, if you add omega-3 and vitamin E, those are both going to help you with the hot flashes. Hormone replacement, it helps prevent that because the estrogen keeps our joints lubricated.
Hmm. Oh, that's good to know.
Well,
Yeah.
and I know, Bobby, that they had talked to you about hormone replacement, but you were not wanting to do that.
Mm-mm.
So how does it make you feel hearing Dr. Jones say,
Um, I would
Well, no,
take
no,
a
no, no. What
vitamin.
I'm recommending is her to start the alternative, because
okay,
Yes.
there's a point in
Yeah.
your life, in all of our lives, when we hit perimenopause and menopause, is we've got to say, okay, either this or this. You remember those
Right.
little things, either the little
Yes.
diet
yeah,
stuff, either this or
Yes.
this.
yeah,
you got to do something, because if you
Mhm.
don't, then you're going to find yourself taking nonsteroidals or ibuprofen, or decreasing your activity, becoming more and more miserable because it's now become a disability. So
Mhm.
if you don't want to do hormone replacement, then for sure you need to get on. And we can talk about that after the show, on maybe how much would be the right the dose for you that would be therapeutic for joint
Mhm.
pain. And you're taking your vitamin D. The other thing is when you had your hysterectomy at 40, you're in your early 40s.
Yes.
When you have a hysterectomy early on, sometimes in some patients it causes you to have the ovaries fail sooner than they would had you still had your uterus, because they're removing some of the blood supply that came from the uterus that would actually be blood supply for the ovaries. And so the
Mhm.
ovaries can begin to fail. So you may have been actually going, 10 years or so with low estrogen levels, and now you're becoming symptomatic.
Mhm.
And
Great.
Kathy, can I ask you a quick question? Is there a recommended dose like for treating inflammation for because I do take it. I'm just curious. Is there?
for omega-3,
Yeah. For what is it? I mean, well, I'm saying because I take the hormone replacement therapy too, but is there one for or were you referring to the omega-3 when you were
I was
saying
referring to the omega-3.
Oh, okay. What is the recommended dose for
Okay,
that?
so here's the thing. So omega-3 you can take anywhere from, so most capsules are 1,000, right? So you can take
Mhm.
anything from 1,000 to 2,000 a day. When you have inflammation, you need to move that up to 3,000 to 4,000
Got
milligrams
it.
a
I'm
day.
gonna check that
So
out. Okay.
Okay.
I take 2 with my breakfast and 2 with my dinner. And now make sure you wet your whistle, because
Mhm.
it's a big oil pill,
Yeah.
and if
Yeah.
you try to swallow it dry or with
Yeah.
food, it can get
Yes.
stuck in there. But
Okay.
it's an awesome antioxidant, anti-inflammatory, and then when you add that vitamin E with it for your hot flashes, you're going to find that your internal inflammation is going to decrease.
Okay.
And so your overall body joint pain will go away. You'll find some calming in your hot flashes. And then, we could possibly even add some plant-based. Sonia, did you ever do any of the plant-based like phytoestrogens, like black cohosh, red clover,
I
evening
never did it. I
primrose?
mean, I've heard people talk about them, but I never did. Surprisingly, I never tried any of those. So I have no experience with any of them.
Was
Yeah.
hot flashes, did you ever have
Well, that wasn't a big thing for me. I
yeah.
mean, I would have it it wasn't like every night. But I had them,
Mhm.
and they weren't like where I'm super wet, like soaking wet or any of that.
Right.
Mine were
Right.
very
Yeah.
mild. And it's
Mile.
weird. A couple times I remember being at the hairdresser and I could feel myself like getting warm, and my hairdresser was like, "Oh my gosh, are you having a hot flash?" And I'm like,
Yeah. It starts
She
at your
says, "I
head.
could feel your head is on fire." I'm like, "Oh my gosh."
Mhm.
Yeah.
Yeah.
Yeah. But it was never like, I mean, I know I've had, and Bobby, you don't know it, but I am like the menopause poster child. If there was ever a symptom, I typically have had one or at least one of them. So, but yeah, I never experienced, I mean, I've heard people talk about them, but I've never taken any of those, or I never tried any of those.
Well, good for you, because the hot flashes when I went through, that's what kicked my butt.
Mm.
It was, and this was 15 years ago or so, and when there were not a lot of options, and the options we did have, my mother had breast cancer, so that was when, remember the study that came out and said first everybody should get hormone replacement, then it was nobody should get hormone replacement.
Exactly.
And then so when I went through menopause, it was that nobody should get hormone replacement, plus my mother had breast cancer. And so it was tough. And so it forced me to learn about all of the other things that worked. But I was early. I had a hysterectomy early on too, probably at 40. And then maybe around 46, I started having, well, no, so my menopause wasn't that far down. But at 46, I started having hot flashes, but they were debilitating,
Ooh.
and I know with you work with patients, and you could probably be in there doing a little interview, and all of a sudden, do you start breaking out in the sweat, or yours just at night?
It depends. It depends. It could vary from in the day and at night as well. And
How's
I
your
have to put
sugar
the phone.
intake?
My sugar intake is not. It's not bad.
Okay.
I'm not pre-diabetic or anything like that.
Okay. Okay. Because sugar,
Mhm.
for a lot of our listeners that may not know, is that sugar can also, just refined sugar, sweets, cookies, candies, donuts, that kind of stuff, can trigger hot flashes. And
Mm.
so if your hemoglobin A1C is okay, then you're good there.
Yes.
What about spicy foods? You said no.
Spicy food. I eat spicy food, of course. I'm
Gaily?
married to a Jamaican, so we eat the jerk
Okay.
pork, the jerk chicken, the spicy curry goat.
Okay.
We
See, well,
eat spice.
there you go. So when you interview someone, I interview somebody, I just start with one because my thing was sugar. So,
Mhm.
for me to take sugar out of my diet brought my symptoms way down. But nobody
Oh.
told me that. I had to figure it out. So
Mhm.
you back off something and you don't know, if you don't know that's what's making you feel better. So you might have even noticed a difference in your symptoms while you were away from American food. Did you
Uh-huh.
notice that at all? Did they?
Actually, in Japan, I was sweating bullets,
Oh, were you? Okay.
Was it
and it was
because
cold
of the
there.
temperature or
It was cold there. It was
uh-huh.
just a lot of walking,
Yeah.
walking.
Yeah.
It was cold and I was sweating bullets. A lot of
Yeah.
stairs, a lot of walking. Yeah.
Yeah. Well, and yet right now you've done nothing to help. So your body's not prepared for anything. And so it looked at that trip overseas and then everything that you were doing, because that's another thing is that when we're going through perimenopause, and we're stressed at work or we have a meeting or there's something going on, you're
Hmm.
bound to have your hot flashes because really it's a stress response.
Hmm. And I did want to ask you, Dr. Jones, muscle mass.
Hmm.
I noticed that I'm losing a lot of muscle.
Hmm. Hmm. And again, estrogen feeds our muscles. So there's a lot of good things that estrogen does, okay? And so when we look at even just muscle mass, women begin to notice the decrease in the muscle mass and an increase in their weight. And that doesn't make sense because
Hmm.
muscle weighs more than our adipose tissue. And there's two ways that you could look at handling it. One is there are supplements that you could take to help with the mitochondria on how they act within the muscle during the response. Or another way is, again, the simple easiest way to stop hot flashes for anybody is to do the hormone replacement. But those patients
Mm.
who don't have to look at the alternatives, and alternatives would be supplements that help your muscles get oxygen and continue on their growth process instead of beginning to atrophy because of the lack of estrogen. Your muscle mass actually comes from the microbiome, your gut balance. And so when
Hmm.
in functional medicine, we look at that gut balance and we look at redirecting the estrogen that you do have to the strong pathway so that your body still feels balanced. So you're out of balance most likely because the microbiome is out of balance. The way in which you produce, we actually produce estrogen up until like mid 60s, till about 65. Those who
Oh.
become symptomatic, there's something going on how their body is either excreting the estrogen or converting it into the weak estrogen.
Hmm.
But those ladies who really don't want to, there is and it falls under functional medicine and
Hmm.
balancing that way. So we could start with looking at some supplements first, and if that doesn't
Yeah.
work and it's not
Hmm.
better, then we can look deeper into trying to help. But I always
Right.
like suggest kind of trying the supplements first.
Hmm. Okay.
As we were talking about the omega-3 fatty acids, I just remember being a kid and my grandmother was always giving me cod liver oil. Oh my,
Liver oil.
oh Lord. And
I
little did
grew up
I
with
know
that
that
too.
it was good stuff, right?
Yep.
Yeah,
Hmm.
exactly. I didn't think
Hmm.
about that. They used to push that a lot. The
Yeah,
elders, like my grandma, yeah, they would give us that a lot.
yeah,
I would prefer the natural way. I don't want any,
yeah.
medicine in my body that gonna trigger something else.
Yeah.
Hmm. Hmm.
Yeah. And
I
here's the
think that's
thing,
most people are moving in that direction. I think
Right.
yeah.
that
Hmm.
everybody is moving in that direction now.
That's
Yeah.
right.
Yeah. Hormone replacement, especially nowadays, plant-based, bioidentical, topical, meaning put it on your skin or put a patch on. does not have to go through your liver. You can use the hormone replacement in the vagina. All of it is very safe for the right person. But there are alternatives that are more than just going to CVS, giving me a supplement, and let me try this. And you spend hundreds of dollars on supplements. There's ways for ladies who are struggling. And, you know, Bobby, we've got to see where you are in that struggle, because we can start some of the normal natural things. But if you're still struggling, I just want you to hear it from me, because you may not hear it in the doctor's office. They'll say, well, just, you know, double the dose, or just keep taking them, or it'll go away. It'll pass. And usually when you're struggling with your symptoms, that means something more is going on.
Well, I'm gonna watch it. And if it gets, you know, to the point that I can't handle it anymore, then I may go to the next step. But for right now, I think I have like a mild case that is not severe right now. So
And I
let me
think
keep my
after we
strong.
talk, I can make some recommendations specifically for you that you can for some supplements to start on. Because the other thing is, most of us are not going to get away with taking nothing. I mean, everybody should be on something for brain health. Everybody should be on something for cardiovascular health, supplement wise. So we've got to learn how to start supplementing during our perimenopause and menopause. So even just if we had a conversation about, okay, well, this is going to help with my brain, this is going to help protect my heart, this is going to help protect my hemoglobin A1C, this is going to help protect my joints. It may be 4 or 5 little supplements that you take every day, but you're protecting your aging. Does that make sense?
Right.
You know what, Kathy, it's so good to hear you say that, because I am one of those resistant people. I'm just like, do I have to take all these pills? But, you know, I just have to change how I think about it. I'm protecting my aging.
Yeah.
Well, you know how I know that? Because you know how, Sonia, you know how I know? Because she never adds even on when we start saying, I'm taking this and I'm taking that. And Denise is always just,
she says quiet. Yeah.
Yeah.
I feel like,
because here's the thing that no one tells us is that we can set a layer of protection now so that we don't, like my mother passed with Alzheimer's. Well, I figured out, I looked at her lifestyle and figured out that's what. And I don't want to repeat those things in my life. And if you've got heart disease, stroke, diabetes, those things can be unfolded and or unpacked so that we can figure out what are the healthy lifestyle things for you, and then the protective supplements. There's a supplement that will help your body or allow your body not to produce the same diseases, disorders, and imbalances if you didn't take them. If you just let your body do life, you're bound to to come up with something. So it's kind of good that you're having these hot flashes, because it really is a stopping point to say, hey, I got a whole nother half to live. And if I need to take get introduced to, it's really introducing us to our future, the vitality of who we are going to become, moving forward from this point on until God says 112.
Ooh. And honestly,
that's too long for me.
Bobby,
Girl,
without saying how old I am, I wish I heard you say you're 51. I wish that someone had given me all this information that I have now when I was 51, because I just feel like I would be in such a better place right now. I mean, I'm, without saying again how old I am, I'm learning these things that Dr. Kathy's sharing with you now, and I'm so far down, much further down the road than you are. I think it's a great thing when you can get this information, and that was one of the reasons we decided to do this podcast, is because we wanted to be able to help women that are going through these things, and also to prevent, women, really so that it becomes like a common thing, just like we're talking, that women talk about this on a day-to-day basis. I mean, before it seemed like it was something that was taboo. Nobody wanted to talk about it. But now, if women are getting this information, way before they even get to that point, then they know what to do when they do get to that point where they're at perimenopause.
Right.
Yeah. And they'll be able to navigate it exactly the way you want to, Bobby. And based on your symptoms, all we need to do is just get you started on some supplements. I don't see anything in your just from talking to you that you don't need hormone replacement unless you wanted
No,
it. You don't
no.
need it. I never took it.
Mm-hmm.
But we do need to do something supplement wise.
Mm-hmm.
All
I
right.
agree.
So I'm going to say now, here and now, I am committed. I'm committed. I'm going to start doing these so I can have something to say about it.
Okay, are you at least taking vitamin D?
Yes.
Okay,
Yes.
all right.
Yes.
Denise, I was going to jump through this microphone.
Don't jump through the microphone.
Okay,
I
so
should get up and get my bottles and line them up for you all so you could see how many supplements I take a day. It's embarrassing, actually. I need to move them because when people come to my house, I'm like, oh, they're going to be like, well, golly, girl, you got a pharmacy over there.
Is
But
she sick? Yeah. Well, here's the thing. Every woman hitting perimenopause should be taking vitamin D.
Okay.
Yeah.
Every woman should be, and also an omega-3, because an omega-3 will help reduce your risk of heart attack and stroke. It'll keep your
Oh.
joints healthy. It helps with the hot flashes. And we increase the levels when that joint pain is bad. And so, like, even with you, you could increase to the 3,000 to 4,000 milligrams for a couple of weeks. Once the joint pain is gone, then you go back to your maintenance dose, 1 or 2, omega-3s a day. If you can't sleep, you should take magnesium. There's
Oh,
certain
that.
magnesiums that we should take if we're concerned about brain health. Every woman should be taking some form of calcium, whether that's
Mm-hmm.
dark green leafy vegetables, nuts, getting, some dairy, getting things in their diet, or taking just a calcium supplement.
Well, with the calcium levels, even though my calcium levels are normal, should I still be taking calcium?
Yeah, because it's you're just supplementing. You would just take something like a normal daily recommended dose of your calcium. The thing is, so when you look at should everybody take calcium? It's the normal recommendation for the menopausal woman. You need to make sure that your calcium is followed on a annual basis, and have your doctor make a recommendation. You might tend to go more on the higher side. You might be getting a lot of calcium in your diet, or some other, through some other means, whether it's dietary or dairy,
Yeah.
or through some type of supplementation. So if you're the thing about the calcium is the vitamin D is only the usher. It's the bridge that gets the calcium in. If you have enough calcium and you're going to the doctor yearly, then you don't necessarily need to
Okay.
be on a calcium
Did she
supplement.
get the calcium? But also, if you're taking a multivitamin, like do they have so sometimes you can get the basic requirements, like
Right.
just
Yeah.
from a multivitamin as well.
And
Yeah,
believe it
yeah.
or not, the majority of women, if you have and I think the Jamaican diet does have a lot of, isn't there a
Vegetables.
lot of vegetables?
Yeah, green
And
leafy.
certainly more than the
Yes.
American diet.
Yeah.
So you
Yes.
may just have a whole enough diet where you're getting your greens and your calcium in with your diet. That's just rare in
Yeah.
the American diet.
Yeah,
You
because
know.
this morning I had a plate of callaloo, so with the vegetables, the green vegetables, I'm good in that department.
Okay, very good. So yeah, so I think you're getting, so whether it's dietary or a supplement, it's, they're both the same. So I think you're getting that.
Okay.
Also for hot flashes, if you are doing spicy, or, you got to learn your triggers. So if you notice that every time I try to drink my hot coffee in the morning, I get a flash,
Mhm.
you can start avoiding those. It may help you to avoid some of the spicy foods, may not. You might just, when you add the omega-3 and the vitamin E, that might help that spasm for you.
I
Well,
didn't have a lot of hot flashes, but I did notice that if I ate something spicy, it did kind of trigger, but they weren't, but I mean, like I said, I didn't have them frequently, but as I started monitoring, it was definitely after I had eaten something spicy, not
Something
sweet, but
spicy.
definitely spicy. Yeah.
Well, just don't mess with my coffee. I mean, if it's a choice between hot flashes and coffee, listen,
Give me
I'm
the
gonna
hot
drink.
flashes.
No, I think we all make that choice. Well, it is what it is. Just drive to work with your bra on and tint your windows, and then but
Right.
it's just one of those things. Let's see. Are you exercising at all? Do you have time to?
No, I need to get better at that. I'll get on the bandwagon and then I'll fall off.
Yeah.
I have to get better at exercising on a daily basis. But
We all do. Don't feel bad. We all do.
right, work,
Yeah.
come home, you have another
Yep.
job when you come home. Sometimes you just don't want to work out.
Yeah.
You just don't want to exercise and do absolutely nothing. I would rather
Amen.
make a glass of wine and sit down.
But let me make a suggestion that may help a lot of people as well. You could actually start, if you're off on Saturdays and Sundays, you could actually start with just maybe towards the morning when it's not so, because we're in Florida. So for those of us who
Right.
are talking about it's below zero, why is she telling her to go outside? You could do 15 minutes. So you could walk, you could do 20 minutes. You could walk 10 minutes up the street and then 10 minutes back on a Saturday morning or Sunday morning, and that's it. And
Mhm.
then after about 3 to 4 weeks of doing that, you're going to feel like, go 5 more minutes. And now
Mhm.
you're at 30 minutes.
Mhm.
And then once you have mastered that, then it becomes fun, because now you put on your headphones, you're listening to some kind of
Podcast.
self-help.
Our
What do you?
podcast.
Mhm.
That's right.
You're listening to the Menopause Diaries podcast.
That's right.
And
I
then on
love it.
Sundays,
I love it.
and then on Sundays, your church podcast.
Mhm.
And before you know it, you'll enjoy the effort of walking, learning something. I listen to, my little podcasters, all the little dirt about
Right.
the entertainment, and it distracts you from what you're doing. And here's what people don't understand. It's just like putting one foot in front of the other. If you just did it on Saturdays and Sundays for 20 minutes, you will naturally want to do more. So don't do more than you can. Don't do it. I wouldn't start on weeknights. It's too much. You work 10, 12 hours.
Oh.
But make intention to do, even if you just made an intention to do 12 minutes on Saturday. Walk up the road 6 minutes, walk back 6 minutes.
Mhm.
And
And another thing,
it's not even about getting weight loss. It's also joint health. It's just
Getting
Mhm.
things moving.
cardiovascular health.
Moving.
Right.
Yeah.
Yeah, we
I-
need
I
to
always
keep
tell
those bones
people-
lubricated as we get older.
Yeah.
The lubrication is important.
Well,
Yeah.
and things get stiff and our
Mhm.
muscles get weak. And I do Pilates, and one of them, Sonia, are you doing Pilates? Because one
I
of the
did.
things
I've
is
done
they
it.
do this.
I'm thinking of going back because I had started stretch. I went from stretch zone to stretch lab, and now I'm like, okay, I think I need to go back to Pilates.
Because
Yeah.
Pilates
Mhm.
really concentrates on, like, we do these movements, we're always moving our shoulder back, and I'm like, yeah, that's because you want us to be able to wipe ourselves when we're 70. You know what I mean? And even if you, because I started Pilates, I had a head injury, and I wasn't able to exercise for a while, and I had dropped something on the floor, it rolled under the bed, I got on the floor to get it, and I couldn't get back up. And
Oh
this was
my.
just a couple of years ago. I couldn't get back up. And so I said I had to do something, and I joined Pilates. And it's just really whatever you do, even if you're just walking, it's your bones. And that also, for those who have thinning of the bones are concerned, anything you do where you're moving your joints, the muscle is rubbing against the bone, and it decreases your risk of osteoporosis or osteopenia. So it helps
Mhm.
it helps keep the joints lubricated. And if you're taking that omega-3, your joints are lubricated, and you want to move, because as we get older, we want to keep our strength. So even just let that motivate you. Don't overwhelm yourself, but say, I can do 10 minutes on Saturday. Put something on nobody else
Mhm.
wants to listen to but you, and that's your time to listen to whatever that podcast is. And then you come home with a smile on your face, and you're ready to start your Saturday and Sunday. And before you know it, in a month or so, then you're adding a day in during the week. And then you're like, oh yeah, I got to leave work
Mhm.
early. I've got to go to, to take care of you. we've got to prioritize ourselves.
You know, I
So,
think when people think about exercise, they start thinking about high impact and, you know, jumping around. And it doesn't have to be like that. Like you said, just simply going for a walk. And then you'll build up to whatever it is you want to do, or doing Pilates. I mean, yoga, you know, just movement of the body.
Yeah.
Mhm.
It's getting air in the lungs and getting bad air out. And those of you who might want to just test, well, is breathing really a big thing? I know that that is to just sit where you are and take a deep breath in for a slow count of 5, and expand your lungs, and then purse your lips like you're blowing out a candle, and blow it out for at least a count of 5 or more, and do that 3 times. Watch how those 3 breaths make you feel like you took some type of sedative. And that's the relaxation and the joy you get from just moving air in and out of your body. And you can, so Bobby, like even at work, when somebody's tapping on that window and you had already said, ma'am, I don't want to be with you just a minute. You just sit there and you take the 3 breaths, you know, to the count of 5, blow it out to the count of 5, do it 3 times, you'll be good to go. It's oxygen. So just moving 10 minutes pops those blood vessels open in your brain, and you come back, you'll feel calmer, you think better. And that's the little tidbits, those are the little bits of just to make you want to do it on Sunday, and then make you look forward to doing it next Saturday. When you go out and join a class, they wear you out where it's like, no, I don't want to go back. Sorry,
not going back.
not going back.
Yeah, I'm not going to the gym with a 20-year-old in there.
No, taking the pictures and all
Going to
that.
a
Like,
gym
can I get out of the
I
picture?
don't, yeah, I'm not going at all. Yeah.
Yeah.
I
Pilates is a good, because it's mostly perimenopausal and menopausal women, and then the younger women are like, they're all about, you know, like just the movement and all of that. It doesn't feel like going to the gym. I couldn't imagine.
It's not like a gym experience at all. No, it's very, and for me, I was always in a beginner's class. So, I mean, I never graduated from the beginner's level, but yeah, so I didn't feel the pressure. Like, I will not step foot in a gym. That's just not my thing. I don't,
No.
yeah.
Do you exercise, Sonia?
I walk. I do. And to your point, I do walk. I hate that it gets dark so early now, but I mean, even though and there are days like, say, like right now, I mean, I have gone to walk, I mean, in a well-lit area.
Yeah.
Some days I just feel like I need to get in, like, even if I get in 20 minutes or whatever, and I'll say I'm going to do 20 and I end up doing 30, like you said, because I mean, at the end of the day, I feel better. I sleep better. It does make a difference. I'm not going to.
Would you do a Saturday and a Sunday morning? Like, you know, I mean, get up 30 minutes early and,
okay, I'm not going to even lie. So, you know, I'm not a morning person. So, cause even that's why I don't do it in the morning. I mean, I know a lot of people are like, why don't you get up like before the sun gets up? But for me, I just personally, it works better for me in the evenings. Even if I've had a hard day, sometimes if I've had a really, really, really bad day, I will just, because it helps bring me back down and just kind of settle me a little bit. But yeah, I mean, I've done it in the past, like if I couldn't sleep and I'm like, oh, if I can't sleep, I might as well get up and go for a walk or something. But I just, honestly, I'm not a morning person. So that's why I don't. But I mean, I know, you know, I know probably if I was more of a morning person, I would do it. It makes more sense, but yeah.
But you'll notice, you know, for our ladies, is that just any type of routine exercise is gonna lessen the hot flashes, is gonna increase your mental capacity,
your energy.
And it's just one step that then allows you to feel better about taking the next step. It's like starting somewhere. Denise, your exercise, please.
We do.
I do.
Like, I probably go every day.
It's just me and you, Kathy, again. She's not.
No. I do, and I tell everyone. I say I don't exercise to lose weight. I exercise to keep my heart healthy and keep my joints moving. So yes,
right.
Thank you.
Yeah.
But Dr. Jones, let's go back to osteoporosis.
Mhm.
By being in perimenopause or menopause, do that cause osteoporosis?
Yes, because it increases your risk of developing thinning of the bones, osteopenia
Mm-hmm.
or osteoporosis, because estrogen is needed to, it's part of what's needed to help get the calcium into the bone. And so
Mm-hmm.
if somebody has, there's certain um people who are at risk for it, and those patients, hormone replacement therapy would be therapeutic. Let's just say
Mm-hmm.
somebody's mother died of a hip fracture, and their grandmother had bad osteoporosis, and had the little hump in the back. Those patients would benefit from hormone replacement. So it
And
does
the
help, but it only needs to be used, in my opinion, for that if you have a family history of osteoporosis, because there's
okay.
other ways. And I feel that way about everything. If you've got a family history and you don't want to do all the other things, and it's not a lot, if you just don't want to learn about it and change your ways, then hormone replacement would be an easy way that you could protect yourself. But
Mm-hmm.
for especially African American women, we already have a baseline sort of elevated level of estrogen that's have been protective to our bones. And then
Mm-hmm.
if you just add the little bit of exercise where all you're doing is moving your legs and your arms, and the muscle is rubbing against the bone, you are stimulating bone growth just doing that. So when someone says you have to take this so you don't get osteoporosis, maybe you should if you have a strong family history, but you don't have
Mm-hmm.
to. So
Mm-hmm.
everything that taking hormone replacement can help you with, they're natural. And that's what we need to learn, is that
Mm-hmm.
there are ways that we can treat all of these things, and it's just lifestyle changes and making sure the body is completely balanced on the inside.
And
Dr. Kathy, do you find, go
what
ahead,
is
Bob.
the recommended age for bone density test?
So now, Denise, isn't it now 65?
Well, yeah, I think
I
that's what
think it might be,
insurance is going to pay for it then.
Yeah.
Yeah.
Yeah. So
65.
yeah,
I
65
think
is
it,
the recommended age now to start bone density, and then it's based on what your bone density, unless
You have a
or
family
you've been
history.
10 years without estrogen.
Okay.
So let's just
Mm-hmm.
say somebody had a hysterectomy and their ovaries removed at 40, then 50, you might want to look at some bone density, but certainly earlier in a woman who has a family history of osteoporosis.
I got my
Okay.
first one last year. So, I mean, and I had never been, but so I don't, it might be even a little bit earlier because I got mine.
Yeah.
Do you
I
remember,
think
Denise, the new recommendation?
yeah,
I think
I
it's
think they
60.
moved it from 60 to 65.
Yeah, I
Oh,
think so too.
I
okay.
think
Yeah.
so.
Oh,
Yeah,
Oh,
yeah.
okay.
Because when they actually looked at the incidence of osteoporosis, unless you have a family history, that 65
Yeah.
does it. When
Yeah.
I
but
know that earlier on in my career, I think we were starting at, it was something ridiculous,
I think it might have been
55 or
50,
60.
65 because
Yeah,
I sold when
yeah,
I was in a pharmaceutical sales
yeah,
rep, I sold products for osteoporosis. And
yeah.
in my memory, I believe it was 50 to 55. They were saying that you
Yeah.
start
I
getting a
remember
bone
back
density
then.
test.
Yeah,
Yeah,
but
Mm-hmm.
it's been,
it was way, way earlier. And so yeah, that was one of my main products that I sold back then. Yeah, yeah.
what did you sell? Which one was it?
Fosamax.
Okay. Yeah.
Yeah, yeah. I sold that, and but so I was well averse with that, and Miacalcin, which was the nasal spray, and Fosamax was very difficult to tolerate. You had to, I mean, there were so many restrictions. But I was going to ask you back then, and I don't know if that's still true today. That was one of the things, though, that Black women, I mean, you don't see it as frequent as you see it in other women. Is that still the case? I
It's
mean,
still
back
the
then,
case. We
yeah,
have very
yeah.
dense,
Mm-hmm.
we have
Yeah,
very
Yeah,
dense
exactly. So
bone.
that's one of
we
the
have
things
dense
we have. Yeah.
bones because we typically have, well, we have all the good from estrogen, so
Yeah.
skin, hair, nails,
Yeah.
but we have all the bad as well. So
Mhm.
we have more fibroids.
Mhm.
So we have good bones, but we're going to have the
bumpy
fibroids.
breast.
We're going to be the ones getting the fibroids taken out,
Mhm.
or the hysterectomies from that. So,
Yeah.
but it's just because we just tend to make more estrogen. And remember, even after your menopause, you may still make estrogen up till about age 65. But when you've had a hysterectomy, that could be cut down because of the decreased blood flow to the ovary. So you might require to address that earlier on. So no, I just looked it up. It's 65. 65
okay.
is the
So
new
they changed
recommendation.
it
65?
then.
Yeah,
Okay.
65. One of the things is that we've worked harder over the years on, telling people take your vitamin D and your calcium. So that's one of the things.
Mhm.
And that when you do studies for years and then you realize, hey, the risk is not what we thought that it was.
Mhm.
And so then they reclassify it, and then they look at people, they characterize your risk. Super thin people, Caucasian women, and
Yeah.
history with osteoporosis
Yep.
would be the ones that you would target, hormone replacement therapy for sure, just for osteoporosis. But anybody else can do the things that we talked about, vitamin D, calcium, have the dietary things, and exercise. Anything
Mhm.
that causes, any type of exercise that causes the muscle to contract against the bone.
Yep.
Mhm.
Now, the problem though with osteoporosis is the downside is if you get it and you break a hip, 20% of women die
Exactly.
from hip
Oh,
fractures.
Yeah.
wow.
So it's rare, but you got to be aggressive for those who are at high risk.
Mhm.
All right. So I'm not at high risk, but I'll let you know I'm going to take my calcium and vitamin D.
Okay, very good. That's a start. Oh yeah, everybody clap. There in the audience clap, because that's a big thing. All
Okay.
right, and we're gonna make sure next episode you still taking it.
Okay. Exactly. Right. Hold her to the
But
fire.
Denise, you may still be getting, because you may be getting a lot of your supplementation or your vitamins from your diet, because you
Yeah.
eat a
From the
pretty
food.
healthy whole diet. You eat a Jamaican diet?
I sure do.
Okay. Maybe I need to go to Jamaica. Okay, Denise, when we're going to Jamaica?
Oh, see now, there you have it. We got to go to Japan. Now we got to go to Jamaica.
There you go. When I was in
It's
Jamaica, they
field
did
trip.
some kind of pureed pea soup.
Oh, yeah.
Stupid.
Is it
They make
brown or
a
green?
Brown.
And you
Brown.
serve it for breakfast
Oh no,
sometimes?
Mm-mm.
no, I'm not
Sure,
sure.
with some
Puree?
kind
You
of
mean the
beans.
pumpkin soup?
No, she's
Oh, it was brown, and it's so
I mean,
good.
we drink peanut punch, we drink peanut porridge. I mean, all sorts
Porridge.
of stuff.
Mhm.
You never know what we. So we get all the good stuff, and growing up, of course, in Jamaica. I grew up in the bush, like I like to tell people. I ate organic the whole time. So I think that set me up, and now those organic, strong bones and everything, they're still going. I promise I'm gonna start taking the vitamins.
What was the age of your grandparents or great grandparents when they passed? They were in Jamaica?
Yeah, my
They in their 80s,
grandma
90s?
was 96 and she
Yeah.
died early. We didn't expect her to die so soon.
Yeah.
So,
Oh.
Yeah.
but she, she was running a farm when she started raising me in her 60s. She had her full farm going, and she was out there every day doing her farm stuff. So she was a tough girl.
Well, she said, "No, look,
Strong lady.
what the world has become, baby. I'll see you up there. I'll wait till you go, because I'm heading home." Like I said,
She
God
was
says
tired.
112. She's like, I'm checking out now. I'll be for you. I'll be there at the gate.
Yeah.
Bobby, thank you again for joining us. I hope this has been helpful for you.
Yes, it
Good.
has been.
And this is just like hanging out with the girls in the coffee shop, right?
Invite me anytime.
And I want our listeners to know that Bobby had a glass of wine and she was completely relaxed. And we wish we did, but we didn't have the benefit of a glass of wine tonight.
You forgot to say plum wine from Japan.
Thank you.
Not just
Yeah.
any
With
wine.
whiskey. With whiskey.
With
With whiskey. That's a hot flash concoction. So,
She's gonna pay for it later tonight.
yeah,
I'm going to pay for it later.
she'll put the recipe at the end of the episode.
Yeah.
when I get in bed tonight, everything comes off.
But Bobby, listen, you can just you can just Google my name, Dr. Kathy Swain Jones, and just put in women's hormone wellness. Just go to my website and you can just book a free consultation. And we can talk about, so I can give you some more specific advice to help with those hot flashes, because there's some other things that you want to kind of give you the doses that you need to take to get some relief.
Good.
Especially
I will.
that you've made the choice that you don't want, because if we don't help you in that way, a lot of women end up feeling like, well, no one's really advised me on all the things that or helped me. Just give me the hormone replacement, and they don't really want to be on it. So I want to help you with that. Okay.
Thank you so much for having me.
Welcome.
Well, we have gone through
enjoyed having you.
Yeah. We've gone through a really awesome episode with you in it, Bobby, and we talked about osteoporosis, hot flashes, supplements, and we've gone the gamut. And so tonight we're just happy that you were here. You allowed us to enter into your home and your life, and we thank you so much.
Thank you.
All right, Bobby, remember the breathing though. Those in and those for 5 seconds when people start knocking on that window at work. Calm you down. All right, guys. Such a great episode. We'll see you next time.
All right. Take care. Bye-bye.
All right. Bye-bye.
Good night, ladies.
Good night.
Bye-bye.
This is
Menopause Diaries. Real talk, real stories.
Thanks for listening. Let's thrive together through every
Hot flash,
mood swing and sleepless night. Don't forget to like, share, and subscribe to Menopause Diaries, Real Talk, Real Stories. If you have questions or want to share your story or would like to be a guest, visit us on Instagram at Menopause Diaries Podcast. Let us start a conversation and navigate this journey together.